Behind me, they're wrapping up a celebration for undocumented immigrants. Many of them are now going to have access to healthcare. I'm Catalina Villegas from Paris. That is in sharp contrast to the situation many legal immigrants find themselves in, because now they're being forced to decide between healthcare and a future in this country. This isn't a birthday or an anniversary. It's a healthcare party. It's part of a new reality for undocumented immigrants like Mariana's sister, Bertha, who has thyroid cancer.
She was diagnosed with this disease 5 years ago, but she could never get treated because hospital bills were really expensive.
Mariana and her sister work the fields picking vegetables, and they each have a kid. So the cancer diagnosis in her 24-year-old sister was a devastating blow.
She was really scared because she didn't want to die. She said that she didn't want to leave her daughter.
But everything changed January 1st of 2020.
My sister couldn't be here today, but right now she's in the hospital receiving her treatments thanks to this new Health for All law that passed.
The law, Senate Bill 104, expanded Medi-Cal benefits to undocumented individuals between 19 to 25 years old. That's why they're celebrating, and it's why Todec Legal Center, a nonprofit serving immigrants in Riverside and San Bernardino, has brought Molina Healthcare and Inland Empire Health Plan to this event in Paris to make sure the undocumented population in this area is taking advantage of the healthcare expansion. But 80 miles away in Beverly Hills, a mother and son from El Salvador are meeting with their lawyer.
Thank you for coming into my office today.
Miguel is here legally. She isn't. He was enrolled in Medi-Cal for about a year, until the moment he got a notification from his lawyer, Edward Pilot, telling him to drop the benefits. My lawyer told me that if I kept using Medi-Cal, I could be considered a public charge. Public charge is a Trump administration rule as of February 24th, 2020. It states that if immigrants lean on government services like Medi-Cal, food stamps, or housing vouchers, they could be considered a burden on taxpayers, and the Department of Homeland Security will consider that when you apply for residency. So while undocumented individuals might not see the urgency in getting off the benefits because a legal status may seem improbable for them, for those on a pathway to citizenship, this rule could make or break their future in this country. Right now, I'm not receiving any service because I don't have access. I'm scared that if I use the benefits, it will affect me in the future. Back in Paris, I asked Mariana what she thinks about legal immigrants having to get off Medi-Cal while undocumented people get access. She says it's not fair.
I don't know, it's really sad for them.
Sad because some people were kicked out of this healthcare party.